Hello, I'm Martin Chikichop. I'm Vice President for Research here at the Hospital and Health System Association of Pennsylvania. As we move to a digital age for healthcare technology, and specifically for medical records and for health information exchange, it requires a different workforce. The traditional workforce in a hospital or in a physician's practice, it was largely shuffling papers, mounds and mounds of papers, file room after file room. That's not needed anymore. Not in that same way. And the people who might have moved that paper in the past have an opportunity to learn this sort of new world of health information technology and what it takes to support filing electronic documents, making sure that they get associated with the right patient, making sure that whenever a patient is being discharged or being seen by another physician, that electronic record can follow the patients. It takes a lot of work and it takes a lot of people to do it. The kind of person who would be ideal for this liaison role between the clinician and the IT people are somebody who's a clinician. Maybe some sort of an allied health professional, could be a radiologist, it could be a nurse, it could be a physician that already understands the clinical side and can help to bridge that with the technical side. The question really is, how do they learn those skills? And what oftentimes happens, and what you really have to plan for in implementing these kinds of implementations, is the physician can't see as many patients in the same period of time. For the first month, the first 3 months. Some physicians say it could take as long as a year until they get back to the same number of patients that they can see in the same amount of time. The Office of the National Coordinator for Health Information Technology figures that there was probably at least a deficit of 50,000 people who needed to be trained to help bridge that technology gap, that gap between the clinician and the IT staff. There will become a point where a clinician who's not willing to use an EMR is not going to be able to practice. Much like that, somebody who is accustomed to just moving paper records and is not willing to learn how to use a computer, not willing to be able to understand, this new world. Yeah, they would be threatened by this, but there are huge opportunities by technology if they're just willing to learn. Physicians who embrace this technology can provide better care.